If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 17th season. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we're here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, call the live phone line at 718-499-6101. Secondly, you can email your questions to askthedoctor@netny.net, and we're going to bring them into our discussion. Now, for this episode, we have a great episode planned. We have Dr. Hilary Fairbrother. She's an emergency room attending physician at New York Methodist Hospital, and Dr. Raul Schwartzman. He's a cardiology attending and internist at New York Methodist Hospital. It's great to see you guys, and we're going to be meeting you in a little while. Last week, though, we introduced our newest addition to Ask the Doctor, Kirsten Elizabeth. How are you, Kristen?
Hi, Dr. Garner. How are you?
Good to see you smiling with this weather. Can you hear that? I don't know if the people at home can hear it.
I'm just glad to be indoors. It sounds intense out there.
Yeah, this is, it is intense, like this show.
It broke my umbrella on the way here, actually. So I'm lucky I made it here before it started.
Where did these guys show up selling umbrellas in the corner? Isn't it amazing? As soon as it rains, they're selling umbrellas. What do you pay for, like $6?
Should be like $3.
$3, that's a good one. That's why it broke. Yeah. Very good. So anyway, you had a good week?
Great week, just settling into my new apartment in Astoria, checking out the new restaurants in the neighborhood. So I'm enjoying it.
And your family's giving the vote of approval to the show?
Oh yes, my husband is a huge fan. He loves it.
This is great, great. So anyway, thanks a lot. We're going to be with you shortly. And I want to mention something, Kristen. That show on this coming Sunday at the Church of the Virgin Mary, that's in Park Slope, Brooklyn, on 8th Avenue and 2nd Street. We don't want people to miss that, because here they always say, how can I meet Kirsten in person? How can we do this? Here's an opportunity to go to that beautiful church, take a look at the church, and then come down and hear a show, which will be on the air in a couple of weeks.
Exactly. We're filming it at the church, and from what I hear, the church is beautiful. Isn't that right?
It is magnificent church. Wait, I'd like you to do a little tour with the father there and hear some of the little tidbits about the architecture.
It's a deal.
Okay, so you look for that. And I think Dr. Schwartzman, I saw you at that church.
Been once, I guess.
Yeah, isn't that a beautiful church?
Beautiful.
Very nice.
Building. Yeah.
So before we get to In the News, which is a key part of the show, I want to remind you the number to call is 718-499-6101. A good time to call in right now, where our topics are emergency medicine, general medicine, and cardiology. Now you can also email your questions to askthedoctor@netny.net. Now this brand new In the News. We have three interesting topics today. One is dense breasts, which, women may be told by the doctor, may not be told you have dense breasts. Well, what does it mean? For one thing, it means there's a 6 times increased incidence of cancer. So that means you want to make sure that you're going in for your mammograms and make sure that your doctor discusses any changes with him. Now, also it means that the woman should be notified so she can go for additional tests such as sonogram. Because what happens with dense breast is you have a hard time finding a small cancer because the dense looks white. The dense breast is white, and the tumor is white. So it's white and white, you don't have no distinction. You may need to get a sonogram, you may need to get an MRI to see this. And as of January of this year, there's going to be a new law where doctors must report that on the chart and then speak to you about it and what you're going to do. So women out there demand, if you're not hearing anything about it and you say, do I have dense breasts? The doctor tells you yes. You have to sit down and talk to your general practitioner to find out what that means and what you should do. That's one important thing. Now another thing, new treatment for lung cancer, and this is such a deadly disease, really linked to smoking extensively. And for a certain type, squamous cell cancer, which accounts for about 25% of the deaths that we get in the cases, happens from people smoking. And these people are getting mutations in their genes. And rather than just bombard the body with chemo poisons and so on, if you can make chemicals that can alter the way the abnormal genes work, you can cure it. And they have people now who've been on trial for a couple of years and they're doing very well. And they've identified 60 medications that will attack different types of genetic problems. So what does this mean to you? Well, it means if you know somebody who has cancer, lung cancer, and they have this type, squamous cancer, then they should be asking about trials, which are going to be starting now across the country. And it's going to be different type of trials. It's going to be partnership with a drug company and with many different hospitals. It won't just be like, for example, Sloan Kettering won't just be doing one type of mutation, but they'll be doing anybody who's got a lung cancer mutation. So it's really interesting. It's a collaborative effort, and it's something very important that people should look into. If you have any trouble, give me a call and email me, and we'll follow up. Also, whooping cough. Most people thought this was done, right? A childhood disease. I don't know, Dr. Fairbrother, are you seeing people?
Quite a bit of whooping cough, or what we suspect to be whooping cough.
Right. I mean, can you do that whooping cough, that imitation of that, the whoop?
Like, whoo!
It's pretty good. It's very good. Frank Gorshin. Sounds like an excellent job on that whooping cough thing. I like that. Have you ever, Kirsten, you heard of whooping cough?
I've heard of it. I'm not very familiar with it, though.
Right. I mean, you think that you get the vaccine in childhood and you're done. Apparently, in the 1990s, they altered the vaccine so people shouldn't have so many side effects, and as a result, it didn't work.
Oh.
So now we're getting a lot of people coming in with whooping cough who think they've been vaccinated. So it's a good idea to go out and get a booster at this time. So anybody, tremendous numbers in the West Coast and maybe now heading this way.
We're combining it with tetanus now. When you get a tetanus booster, usually you have pertussis or whooping cough.
Excellent.
In the booster.
So if they're in there, getting it, they had a wound, you might give them the pertussis. And
I give them both.
Excellent. So those out there, think about it. You're probably not covered for whooping cough as well as you should be. Now for the all-important quiz. I don't know if do we have any great sound effects for that? No, okay. We got it from the same guy that sold us in the news, He was on the street. Okay.
Let's not.
Okay. All right, but let's talk through this one. What is in the quiz?
The quiz.
Yeah.
Okay, so we have 2 quiz questions for you today. The first question, Andy Griffith died this past summer, and as you know, he was one of the most popular television personalities ever. So his sidekick, the hilarious Don Knotts, played the role of Barney Fife. Can you name the sitcom and the full name of the character that he played in the 1980s after leaving the Andy Griffith Show? So we need the name of the sitcom and the full name. Second question, since its inception in 1853, the Diocese of Brooklyn has been led by only 7 bishops. Now, can you name the longest serving bishop?
Oh, that's a great question. There's only 7, though. That's amazing.
Indeed.
The whole sense, tremendous. We're going to take a short break, but I want to remind you one more time about this live audience taping, because here's a chance to get on TV, and you go all over the world on the internet with this, and chance to say hello to relatives and so on, right? If you're into being on TV, this is very good, right, Dr. Schwartz? It's nice, nice. Yeah. So let me go over the information. 12 noon, Church of the Virgin Mary, and that's 216 8th Avenue. That's the corner of 2nd Street and 8th Avenue. If you want to find out more, you can email us, but you don't need any special tickets or anything. You just show up at 12 noon, and we're going to get you on the air, answer your questions if you have any. I think you're going to have a lot of fun, and maybe some surprises. Our phone number for tonight is 718-499-6101. Our topics are emergency medicine, general medicine, and cardiology. I see our lines are lit up, so keep trying, and we'll be right back. And welcome back. Before we get to the questions, I'd like to acknowledge Monsignor Bennett, who had a little medical issue over the last couple of weeks. Is feeling better. Great to see you out here, Monsignor. I'm sorry he had to come out with this rain, though, but he's got his galoshes on. I like that. So thanks for coming out here. Kirsten, any shout-outs to our loyal viewers?
Absolutely, Dr. Garner. Today we have a shout out to Mercy Baidu. Mercy, thank you so much for watching our show. We really appreciate it. And I also have some shout outs to some new viewers today. My brother Sammy, his girlfriend Gabby, and my friend Mike. Thanks for watching, guys.
That's so they watch, him and his girlfriend are sitting out there on the couch and what, but I hope he doesn't, it's not exactly conducive to romance, if that's what he's looking for. He's just going to be watching the show.
Well, we don't know what they're going to watch after.
Okay.
Yeah.
So we'll...
They're supporting.
But anyway, I want to thank Kirsten and thank you, Mercy. Nice name for being a loyal listener. Let's find out about our guests and their names. And Dr. Fairbrother, that's quite a name. Fairbrother, what is that?
Thank you. It's from the Isle of Man.
Wow.
Old English name.
It's a nice, beautiful name.
Thank you. I
And-
like it. There aren't
yeah.
that many of us.
I know they tell me that you're coming from Montana.
I do. I come from Helena, Montana.
Wow, what's the capital of Montana? Anybody out there know the capital? You know, Kirsten? That's a tough one. Do you know that, Raul?
No.
No, what is the capital of Montana?
Helena.
Helena, okay, it was a trick question. Very good job, very good. And you're an emergency room doctor.
I am.
Tell the audience what that means, like being an emergency room doctor and why you went into it.
For me, being an emergency doctor is all about helping people in their most acute time of need. So if that's because it's the middle of the night and your doctor's emergency line isn't answering the phone, or if that's because you just fell down the stairs of the subway, we are there at every moment, 24/7. And that always has been really important to me. And I just get to see whoever comes in the door. You didn't make an appointment. I don't know what's coming in. It could be crazy. It could be just run-of-the-mill kind of stuff.
So you never know what you're going to see, but she's here to answer any of the questions that you have. That's the great part about being an emergency room doctor, that you can talk a little bit about every subject.
A little bit about everything.
And
So
we need
at
that.
least
We
a
need
little.
that. But anyway, thanks for coming down, and I know we've got a lot of calls.
Well,
So thank you for
thank
taking
you for
busy
having me.
time out.
I'm
Yeah.
really happy to be here.
Great. And Dr. Raul Schwartzman. Now, another interesting name. What part of the world would that be from?
The name from Eastern Europe, so means black man.
Uh-huh.
Didn't apply to me, and I was born in South America, in Argentina.
Oh,
So that's what the
how are things
family-
in Argentina these days?
How is sorry?
Things are good in Argentina?
No, no, so. It's
Good steak, right? Good restaurants?
I would say it's the best probably.
The best in the world,
I
yeah.
think so. That's my
What's your
impression.
favorite steak restaurant in New York?
The thing is, if we want to get Argentine meat, it's a problem. So it's banned for some political reasons. So there are a few in Manhattan that closed. What was Industria Argentina, which means made in Argentina, but it's gone. So Peter Luger is here, but I don't like when they put a cow in front of you on the table. It's kind of impressive.
Yeah.
So I prefer to grill myself.
Very nice.
So
I just want to tell our crack engineer team that line 3, if they could work on that line 3, because I feel bad whoever gets on gets, bumped off of there. So we'll see about that. And you're a cardiologist, and,
Yes.
and you also did internal medicine at
Yes.
some point?
yes,
So you're going to be answering their questions about their heart disease as well
hopefully in a correct manner. Yes.
as... Excellent,
that's the
excellent.
idea, yeah.
What's your favorite hobby?
Music.
Music, piano?
Listening to music rather than playing. Yes.
Very nice. Favorite composer before I move on?
Beethoven.
Good, good. Who do you like, Dr. Hillary, fair brother?
I like all kinds of music. I would say my favorite hobby is probably like handicrafts, like knitting, crocheting,
Are
embroidery.
you one that, like, as you're watching something, you're talking, your fingers are moving? Yeah,
Like
that's...
I could have, could have brought it tonight.
Oh, and
Sat
work
here
during
and
the show,
knit while
yeah.
we do the show.
But anyway,
Been
that's
very
great, yeah.
productive.
Get something done at least.
Yeah.
Okay. I want to thank you on that sentiment. And who are we going to go to, Kirsten? Who first?
All right, Dr. Garner, on line number 1, we have Millie from Canarsie.
Ah, beautiful area in Brooklyn. Hi, Millie.
Hi, Dr. Gardner. I have very thin cartilage in my knee, and I heard of this gel that they inject. Is it safe, and is there any side effects?
Okay.
My friend had it done by a Dr. Tischler at Methodist.
Yeah,
And
no,
she
I
swears
guess
by
a key is to go to the right person. And let's talk about this gel and why it might work. Now,
Yeah.
Well,
Hillary?
first of all, did it work for your friend?
Yes,
Yeah.
yes.
I mean, I think the key to any joint problem is getting yourself to a really good orthopedic surgeon who can adequately evaluate your joints and your problems, because everybody's different. Two people that might have knee pain, they might have very different problems and might have
Right.
very different solutions. So I would see a
Right.
good orthopedic surgeon and go with their advice. There's a lot of different treatments out there, and I have heard of the gel. I do believe it to be quite safe, but it doesn't work for everyone. So make sure you get a good opinion with the orthopedic surgeon.
an alternative
Okay.
could be a rheumatologist if you want to go in there. Not trying to give an ad for my brother, Dr. Bruce Garner, but he was on the show last week. You may find that
Right.
helpful. But as long as you go to the right person, you're going to have you'll have a good chance of it working.
Okay.
So we like
Can
it.
Can I answer one of the questions?
Oh, you think you have the answer?
The bishop question, Bishop Magavero?
You think it's Bishop McGovero?
Yes.
Okay, let's ask our judges. Is the longest, what was the question? Longest reigning bishop in Brooklyn?
Right.
Was it Bishop McGovero? Oh, Millie.
No.
I really thought you might have it there. That was my initial guess.
Oh.
But anyway, they ever do anything with that Canarsie Pier out there where the Bracciamentos used to be?
No,
No,
there's
it's too
nothing
bad.
going on there.
Oh, it's too bad. That was a great area to go and to see the sunset and so on. It was at off the Bell Parkway.
Right. It was beautiful.
Beautiful.
Yes.
Missed that place. All right. Take care, Millie. Have a good week.
Okay, you too.
Take care. Deflated. You could tell in the voice that you could tell like a letdown. She thought she had it with McGovero. All right. Who's next on that?
Okay, on line number 4, we have Pat from Park Slope.
Oh, not far from here. Hi, Pat. How are you doing? Pat?
Patrick, Dr. Garner, how are you?
How you doing? Good to hear from you.
Good. I'm a little disappointed. The person got married.
Oh, I wasn't going to break the news, actually. I was actually, you notice I said family, and then she threw that bit of news in.
Yeah.
All right, but, you know, many...
Dr. Garner, do you believe that acid reflux can cause stuffiness in the nose and headaches?
We got it. Acid reflux and stuffiness in the nose.
I don't know if there's any clear association. There's oftentimes could be post-nasal drip, which is based on your position on being horizontal, you can feel it and at the back of your throat and create also a feeling of create reflux and some chest discomfort or burning feeling.
You ever see a patient come in, he thinks he's having a heart attack and it's just heartburn, reflux?
Oh yes, it's very often, and that is a master thing to distinguish because the speed of treatment and the treatment itself, obviously, and what entitles are totally different scenarios. So we have to work on that.
But Hillary, when the guy comes into the emergency room with stuffiness in his nose, I don't think it's one of the first things you think of.
It's not. I would say the more common thing I see with people who have acid reflux is a chronic dry cough. So they'll complain, oh, I cough, I always have this cough, and they'll try allergy medicine and all sorts of different cough treatments, but really what it is the reflux, the acid causing the cough. So there's definitely an association there, but I don't know one about nasal congestion or a stuffy nose and acid reflux.
Yeah, Patrick?
One other question. Do you believe that acid reflux could cause a panic attack?
Panic attacks and acid reflux. You know, it can. I know.
It's a very good question. I'm not aware of any association, but I wouldn't be surprised if there is one.
There was a tablet article I wrote on the panic attacks. You want to read that, Patrick? And then we talk about different causes, one of them being reflux.
Right. I have
you think you're having a heart attack and you start getting...
It's very stressful to have chest pain. So.
Dr. Hillary, very, very nice lady, great doctor. I've been up there a couple of times in the emergency room. Really pleasure to be around.
Excellent. Thanks. We'd like to hear that, Patrick. You want to take a stab at the quiz?
Yes. Three's company, and his name was Ralph Furley.
Wait a second. Hold your tickets out there. I got to check with the judges. Is it Three's Company, Ralph Furley? Well, Patrick, you know, what do you got, a computer there?
No, not at all, Doc. I used to always watch the show. That was an easy one, Doc.
No, but I thought Ralph was the tough part.
That was an easy one.
Really? I thought everybody knew Mr. Furley, but I didn't know they knew Ralph.
I'll tell you the truth. I thought it was going to be Roper, and the last minute I remembered it was Furley.
Oh, Mr. Roper was Mr. Roper was the original landlord.
Okay.
Right. So that's number 3, Doc. That's number 3 for me.
Wow, you're getting up there. I think we have somebody with about 7, but you're very good. The 3.
Well,
And then don't forget to send us your information at askthedoctor@netny.net so we can send you your prize, okay?
Okay, great.
We're going to be
Thanks,
speeding
Doc.
it to your house, Patrick.
Thanks a
Nice job.
lot, Doc. Appreciate it.
Take care.
All right, Doc.
That show
So,
I don't know. As you watch that show again, that's not really a lot of thinking involved in a Three's Company.
Three's Company?
Just Jack and Chrissy think that the ones, running around outside. I don't know. There's always like a British farce, sort of, right?
Suzanne Summers. So
Yeah.
good. Dr. Garner, on line number 3, we have Mary from
Look at
Staten
Mary.
Island.
I lost Mary. I don't know if I got her back. Let's see. Is this Mary?
Yes.
Oh, great. We got you back, Mary. How are you?
I'm fine, thank you.
Where are you calling from?
Staten Island.
Oh, you're out there tonight. Is it raining out there?
It's pouring.
Yeah. What do you like? You ever eat Italianissimo out there?
Italian.
Issimo.
No, I never did.
It's a great place, not far from the bridge, as you get off the bridge.
No, we usually go to Oriental Plaza.
Oriental Plaza?
Yeah, on Richmond Avenue.
Oh, you like that? What do they have there?
They have sushi. They have all kinds of Chinese food.
Very nice, very nice. We have to try that place out. What can we do for you tonight?
I was just diagnosed recently with congestive heart failure, and I was wondering if you could explain to me what it is and how long you can expect to live with the condition.
Absolutely. How long can you expect to live with it, and what is it, Dr. Schwartzman, congestive failure?
Yes.
Usually means weakening of the muscle of the heart, and sometimes it's the way the muscle contracts and makes the effort to pull the blood out of the heart. Sometimes the way the muscle receives the heart, and if it is a stiff muscle, creates pretty much both the same symptoms, which is probably you're more familiar, shortness of breath or difficulty breathing when you are flat in bed or when you are walking uphill or climbing some stairs. In terms of duration, as Dr. Fairbrother mentioned before, some conditions look the same, they're totally different. So most of the time, I would say 80% of the time, is we don't cure it, we treat it. So it's a chronic condition. So that the communication between you and your doctor and being a team, a long-lasting team, is essential. So
what about the longevity? If she keeps up with the medications and her doctor, does she have expected, to live a normal life?
Yes, absolutely. If provided there's several gray colors in the middle of those who are minimal heart failure, those who are very advanced. So for very advanced, talking about other, is like a totally different animal with transplant or using certain devices to help the heart. But if you are calling, I'm sure it's because you are on certain medications. So there are 4 or 5 families of medication that show to save lives, prolong life, and have a great quality of life also.
Very good. Does that help you?
Yes, it does, doctor.
Thanks for listening. You're going to make it into the show on Sunday?
Who, me?
Yeah.
No, I don't think so.
Why? If you do, I'm gonna make a nice fuss out of you. What do you think?
No.
Still can't get her in.
All right.
Come on, Mary. Come on, come.
No, I can't get there.
All right. Well,
Okay.
thanks for calling.
All right.
All right, Mary.
Bye-bye.
Okay, don't let her call anymore. No, we like Mary. We like Mary. So, okay, who's next?
Well, I think Joe wants to say hi really quickly on line 2.
Is that Joe Stiles?
It
Oh, we got to
is.
move. It's always a pleasure to hear from Joe. Hey, Joe.
I'm here.
Joe, how you doing?
Who's this, doctor?
Yeah.
How are you, doctor? I want to wish you a healthy and blessed holiday.
Thank you.
And I'm hoping everything goes well. I want to ask you something about my thyroid.
Okay.
I got, about 4 years ago, I was supposed to be operating on it, and I avoided that by seeing a lot of doctors. I finally got a doctor, after 5 doctors, put me on Synthroid.
Okay, you're on
I put
Synthroid.
me on that, and he also took a blood test, which nobody did. An endocrinologist. Imagine that. And the first guy wanted to operate, but I'm doing pretty good. But you think I'm in good shape by using that medicine, Synthroid?
So, Joe, what we're going to do, I'm going to ask you to listen to the TV, and we're going to talk a little bit about thyroid, okay?
All right, I appreciate it.
Thanks,
I'll
Joe.
hold on.
Take care. Have a good day. Joe Stiles, 90-something years old, excellent guy. Seems like he's a little bit hypothyroid, and they put him on some replacement. Anybody want to comment on some of the findings that he might have, that he was hypothyroid?
And I think some of the more common findings when you have a thyroid that's not working as well, or hypothyroid, is weight gain. You might see changes in your skin or your hair. Your skin and hair might get really dry and brittle hair. You might have less energy and feel really tired and fatigued all the time. And those are kind of common side effects of your thyroid not working as well as it's supposed to.
You know what I wanted Dr. Raoul to comment on? Elderly people and thyroid disease, any differences?
I can mix from the cardiology standpoint or from the internal medicine standpoint, but putting both together is we have to be extremely careful when you are so-called replacing the function of the gland, not to have certain side effects that can affect the heart. So being the most common, the irregular heartbeat, or putting the heart to extra strength and extra workload and beating fast. So that can be a serious side effect, but it's what used to be said in all books, that was one of the few conditions you can diagnose over the phone because the voice is pretty much diagnostic. I don't know how true that is. Is more.
You heard Joe.
Yeah, his voice was beautiful. And the other thing I said is to have it's relatively easy to control, provided you have regular checkups with the thyroid levels, TSH, T4, T3, etc.
So there's a workup to do, but go to the right doctor again, just as Hillary was
Absolutely.
saying. I'm so annoyed. You know, you ever forget your wedding band and then it's just a noise? You ever get that feeling?
I just got married a month ago,
Oh,
so I don't forget it
sorry
yet.
I never forget it, but in case anybody's looking out there, there's been no change on my Facebook status, so still there.
Oh.
I just forgot to wear this thing.
Yeah.
But anyway, did I remind the audience about the event this Sunday?
You did. Now I'm going to remind
Okay, please,
them.
please.
I want to remind everyone about the live audience taping this Sunday, September 23rd at noon. It's at the Church of the Virgin Mary, which is 216 8th Avenue in Park Slope, Brooklyn. So you guys have to be there. It's going to be a great time, chance to meet all of us here. And to find out more about it, just email us at askthedoctor@netny.net.
And you can go to the Blue Ribbon Bakery there, have a brunch before you come to the show or after the show. You know, you get
I'm there.
It's great. And the show, we're really going to answer your questions. And I like seeing the people. You know, you put a face. I hope some of our loyal listeners, I'd like to see Patrick there and Rosemarie there.
I'd love to see everybody.
That would be great. So, you thinking about coming, Hillary?
Yeah, why not?
Excellent.
I will be there, definitely.
Excellent. Thank you. This is support that we appreciate, the loyal support. We're going to take a break now because it's overwhelming with what's going on here today. So when we come back, though, we're going to be answering your calls at 718-499-6101, where our topics are emergency medicine, general medicine, and cardiology. And let's not forget the quiz. Who's the longest serving of the bishops of Brooklyn in history? We'll be right back. And welcome back to Ask the Doctor, where our topics are emergency medicine, general medicine, and cardiology. And we have Dr. Hillary Fairbrother and Dr. Raul Schwartzman. Call us at 718-499-6101 or email us at askthedoctor@netny.net/askthedoctor. We're now going to move on our phone calls. We're going to zip it up a little bit. So who do we have,
All right,
Kirsten?
on line one, we have Ivan from Midwood.
Ivan from Midwood. Ivan, how you doing?
Hi, Dr. Gunn. How are you?
Good to hear from you tonight.
Okay, I think I have an answer to the bishop.
Oh, sure. Who do you think the longest-serving bishop is?
Joey Bishop.
Joey Bishop. All right. Ivan?
Yes.
Haven't you told us jokes before? I think so. I think so.
I'm the kibitzer. Yeah.
Yeah. It's okay. It's almost funny. Okay. What would be the next one?
She was laughing. Joey.
What do you have?
Okay.
What do you have? Do you have a medical question, Ivan?
Yes. When I'm going to my physical therapist tomorrow, the head of the physical therapy wants to see my latest blood work to see what's going on, why I have this debilitating chronic fatigue. Do you feel there's anything in that blood work that he could see what could be causing or this is just a fallacy?
It's a tough disease, chronic fatigue syndrome. A lot of doctors actually get frustrated dealing with it because there are many unexplained symptoms that you're going to get. And I know that today the new study came out showing a virus not to be linked, that was thought to be linked to chronic fatigue. I think it's a good idea to get all your results and make sure there's nothing else going on because it can mimic, it's a great mimic of this chronic fatigue. You know, are you anemic? But I just ask briefly, any other doctors want to pitch in on that?
Yeah, I mean, 3 things I will go through: anemia, as you say, 4 things: hypothyroidism, chronic kidney disease, and depression that can present us in many different ways.
So Ivan, these are the ways, and these are definitely the answer is yes. He wants to see those results. You should bring all the results to him, and it's going to help him in making the diagnosis.
Okay, and I have one more joke for you before I leave.
Okay, is it clean?
Yes.
Okay, what do you got?
How do you make a tissue dance?
How do you make a tissue dance?
Yeah.
I know this answer.
Okay, Ivan, thanks a lot. I'm going to hear the joke from Hillary. I just don't feel safe here. I'll talk to you tomorrow.
No, I'll tell you. You throw a little boogie into it.
Okay. As much as I didn't like the first one, I think it was better. Somehow you lowered it a little bit. The
Thank
show.
you.
Trying to keep.
Ivan, come on.
I would next week try and. All right.
Okay.
All right. Dr. Garner, you know what? On line number 3, we have Grace from Flatbush.
Oh, I hope we can get to Grace. Hi, Grace.
Yes, hi, doctor. How are you?
Grace, I'm fine. We haven't heard from you in a while.
I know. I didn't know this was your first time back on the air now, right?
Right, we're back on the air every Tuesday night, and you can watch the rerun at 9 o'clock.
Yes, that I know. I see the whole format. You're all sitting differently. Yeah, it looks very nice, and the girls look very, very, very pleasant.
Oh, I'm glad to hear that.
Now, listen, I'm on Prilosec because
She's on Prilosec?
Yeah, I went to the doctor last week. He gave me the flu shot, took my blood, and I was complaining of chest pain. I get like a tightness of the chest and in my shoulder blade, so he gave me a cardiogram. He says he thinks it's acid reflux, and he wanted to give me medicine, but I didn't want it. But I had to call him today. I says, please call my
Okay, Grace, I want you to hold on 1 second now. I'm going to go right to Dr. Schwartzman and then Dr. Fairbrother. Grace is having trouble with heartburn, mimicking heart symptoms. She's been given some kind of a Prilosec, and she wants to know what we think of that.
Well, if Prilosec took care of the pain immediately, I would say this possibly that's what it is, just reflex. But if it didn't, and or she has what we call risk factors, high blood pressure, diabetes, she's a smoker, the family, somebody had heart problems at a young age, I would be more concerned about this being a mimicker of heart disease. So I'll pay more.
Grace, have you been checked out for other heart stuff besides the EKG?
How long should I be on this medicine, though? He didn't say how long should I take it.
How long can you take Prilosec?
You can take Prilosec forever.
Well, I said I didn't want it forever. He says, you don't need to take it forever.
But when we are saying you can take it forever, doesn't mean that you have to take it forever, because probably it's not what you are dealing with. So I think medication is good for certain people having that condition.
I took the first one tonight, and I felt much better.
Okay, Grace, I'm going to have to move on. Do you have an answer to the
answer for the quiz, maybe, for the quiz?
Okay, let's hear it. What's your answer to the longest reigning bishop in Brooklyn history?
I'm taking a chance on Bishop Sheen.
Oh, good guess. Is it Bishop Sheen? Oh, Grace, I'm so sorry.
Okay.
Take another Prilosec. Okay.
Take care.
Take care. Okay.
All right,
Boy,
Dr. Garner.
the phones are hot tonight.
Yes, line number 4, we have Liza from Staten Island.
Liza. Hi, Liza.
Hi.
How are you?
My name is, I'm fine, thank you.
Is this your first call to the show?
Yes, it is.
Yeah, Liza, so we would like to get an idea about our listeners. Where do you like to eat in Staten Island?
On Staten Island, I like East Pacific at the Staten Island Mall.
East Pacific. What do they have out there? Fish?
No. All Chinese food, but it's like delicious. Like mango chicken is one of my favorites with
Dr.
rice.
Schwartzman is acknowledging that he likes that type of food as well.
I do.
What can we do for you? Oh, you're Dr. Fairbrother too. What do we have for you? What can we do for you tonight?
I'm having a problem, Dr. Garner, where I keep having a bad, like a chest pain on one side. And it's like traveling under my arm, and it's going down my arm, and it's like a pulling.
Which side is
And
it?
it's left side.
Okay, Dr. Schwartzman, left-sided chest pain.
Okay.
How old are you, Liza?
50 years old. I'll be 51 in like 2 weeks.
Very good. Okay.
How often do you have that? What are you doing when you have the chest pain?
This just started. This is about 2 weeks now, and sometimes it's mild, and sometimes it's stronger, and it's bothering like my breathing. I keep getting like shortness of breath.
But you get it when you walk up the stairs, uphill, when you...
Nope, it has nothing to do with walking. It just comes. It's just there constantly lately, and I'm trying to call the doctor to make an appointment. I want to see tomorrow if I can get in to see what this is.
You know, the way chest pain presents in women, unfortunately, is not the classic way. So based on the age you mentioned and the description you give, it is a possibility that it's coming from the heart. I cannot tell you 100% it is, 100% it's not. I think it's a very good idea to be seen by a doctor.
Liza, I want to ask Dr. Fairbrother, do you agonize sometimes somebody comes in with this type of pain and you're not sure, is it a heart attack? Do I admit this patient? Is that
Absolutely. I mean, they say it's the $1 million question in emergency medicine is your chest pain from a heart attack, or is it from a pulled muscle, or is it your reflex disease? It could be so many different things, but obviously a heart attack is so serious. So I would also recommend that you do need to get in to see your doctor and just try and communicate to the staff that you're having this pain and this is the first time you've had it and it's relatively new, and see and get into a doctor. And if all else fails, know that we are always there to see you in the emergency room 24/7.
Thanks, Liza. You want to take a stab at the quiz?
Oh, isn't that terrible? And I'm such a strong Catholic. I can't think of his name. I'm so sorry.
All right. Well, I hope you feel better. Call us back and let us know how things work out.
I will, Dr. Garner. Thank you so much.
Take
Bye-bye.
care. Bye, Liza.
All right, Dr. Garner. On line 2, we have Lisa from East Flatbush.
Liza, now Lisa.
Exactly.
Lisa. Hi, Lisa.
Hi, how are you?
Good. You're calling us from East Flatbush.
Yes, I am.
My daughters went to school in East Flatbush.
Oh, I'm in right by Brookdale.
All right. Now, they're having a lot of trouble at that hospital.
I don't go there. I know.
No, I'm not a commentary. I know I know different. It's a tough business these days, the hospital business. What can we do for you?
I had cardiac bypass in 2011, and I have to go to the dentist, but I'm a chicken, and I want them to put me to sleep. I have actually about 5 or 6 extractions.
Oh man, that's rough.
No dentist want to touch me because of my I had double bypass. I have hypertension, diabetes, and
Are you going to be taking medication? Are you going to take antibiotics?
I have no. After the surgery, I believe so. Yes. After the extractions, the dentist normally gives me antibiotics.
Okay. So is your question regarding that?
I would like to be able to go to sleep for them to do it.
So can she go to sleep for this 5 extractions? And she just had a bypass.
I don't think it's a good idea. I think the risk of that is greater than the benefit. So this is well done with local anesthesia. And the risk of bleeding, provided you are on the correct medications such as aspirin, you may also be on clopidogrel called Plavix. The risk of bleeding is much lower than the benefit of, if you discontinue those medications, the risk of having a heart attack is much higher, since the surgery was a year ago, than continuing them. The risk of bleeding is very low.
So it sounds like a good idea to have it done under local...
local anesthesia, and keeping at least one of the two if you're on both aspirin and clopidogrel.
I'm on aspirin once a day.
Yes, so we'll continue baby aspirin. The risk of bleeding while on aspirin is minimal, and the benefit is huge.
Thanks a lot. I hope they,
Thank you.
have courage, okay?
I have to take them out because it's getting there.
Remember, there are medicines you can take to make you kind of zoned out. All right? So you don't, just because you need to be awake does not mean that you really need to be all there.
Lisa, bring a tape of the show.
Okay.
That'll knock her out. Yeah,
my daughter wants to hear my voice on the television, that's why.
Take care. It's good to hear from you.
Thank you. Thank you.
Doctor,
have a
something
blessed
very
night.
exciting. We have a whole long line of people trying to answer the quiz questions.
Oh, wow. So who's first online?
Line 1, Peggy.
Peggy thinks she has an answer,
She thinks she knows.
Hi, Peggy. Peggy.
No, good evening. Good evening, doctor. This is Patricia.
Oh, Patricia. What a beautiful
Peggy
voice.
went away, and it's Patricia.
Yes, thank you. Thank you so much.
This sounds like a theatrical voice.
Thank you so much, Dr. Garner, and congratulations on the 17th season.
Can you believe it?
Unbelievable. How wonderful is that? God
Were you
is
here
good.
in the early days?
Yes, I was.
We didn't have a set like this in the early days. They said it would, maybe it would last, maybe not, and then look what happened.
Isn't it beautiful? Lots of luck to you.
Are you coming out to the show on Sunday?
I will not be able to. I'm terribly sorry. But
Next
I wish
time.
you all the best. Next time, exactly.
Well, what can we do for you?
Well, I believe that I have the answer to the quiz.
Okay, a lot of people are waiting to hear this answer. Who's been the longest reigning bishop in Brooklyn history?
I believe it's Bishop McIntaggart.
McIntaggart.
Yes.
Interesting guess. Is it Bishop McIntaggart?
Oh well.
Are you disappointed? I know it's a stupid question. You're disappointed. I hear.
Of course.
Everybody wants that plaque. Have you seen?
That's right.
I haven't seen the prize.
Handmade plaque, beautiful Japanese materials.
All right, let's try Jenny.
Be well.
From Bay Ridge
Same
on
to you,
line
and good
3.
luck.
She wants to try too.
I'm getting a rush here, but I'm going to move with the flow here. Let's go to Jenny. Hi, Jenny.
Oh, good evening, Doctor. Jeannie from Bay Ridge. Jeannie.
Oh, Jeannie, good to hear from you.
Bay
We were
Ridge,
just in Bay Ridge the other day at, what's that the big restaurant out there? Where all the waiters are running around. It's on the corner.
Oh, on the corner. Oh, I don't know. I go to JT's on 3rd Avenue, 97.
A lot of great restaurants in Bay
We
Ridge.
have so many. You name it. We have it.
Tell me a little bit. Tell me what you think. You have the answer to the quiz.
Well, I do. I think it's Bishop McDonald.
McDonald.
My mother went to that high school, Bishop McDonald's.
Okay, is that the answer? Oh, gee. Who went to that high school? Your mother?
My mom, my aunt, everybody. It's closed now, but it was a great school.
Look at it. This is. Anyway, it's great to hear from you.
Can I just say one thing further, Dr. Garner?
Of course.
Went to your brother, Dr. Bruce. He's wonderful. About a month ago.
Yes.
And my primary is Dr. Anthony Saylor. Wonderful doctor.
What a great man.
From Methodist.
Anthony Saylor is a great man. He's going to be on our show November 20th, so mark your calendars.
I will. Thank you, doctor. All the best.
Take care.
All right. Bye-bye.
That place is Ario that I'm talking about. If you want to go in Bay Ridge, a great place, Ario.
Sounds good.
You know, it's Italian, but people are running around. There's just activity. That's a great life. Great. Kirsty, who do we have next?
All right, we have Mike on, oh, no, actually, right now it's line 4. Jim from Park Slope wants to answer the quiz question.
Wow, big group. Hey, Jim.
Yes, hi.
Hi, Jim. How you doing? You're calling from Park Slope?
Yeah.
I want to tell you a great Greek restaurant out there, Faro. Did you ever hear of that?
No, I don't know it.
It's on 7th Avenue, just to the other side of Union Turnpike, Union Avenue, whatever, Union Street. It's Union Street.
Well, it's,
great
no,
place.
I don't know it. I just know that my backyard looks out on Virgin Mary Church. And
So you're going to be there? You going to be there on Sunday?
I don't know if we're here.
Oh, this is something I said?
No, nothing to do with you.
Okay.
Nothing to do with you.
You think you have the answer to the quiz?
It's Archbishop Malloy.
Oh, let's see. Is it longest reigning Brooklyn Bishop Malloy? Boy, we're running out of name. We probably have gone through more than 7. And thanks to Ivan, we had 8. So, but okay, we'll keep moving. I'm sorry.
Okay, good night.
Take care. Who's next?
Next is Mike from Midwood on line 2.
Mike. How you doing, Mike?
Okay, how are you?
Good. Good to hear from you.
Good. How are you on this rainy night?
Not good. I don't like this rain.
Good. I think it was Bishop McGavero.
Oh, you think it was McGovero?
Yes.
All right, let's see. Is it right this time? It wasn't right a couple of minutes ago, but let's see. Is it Bishop McGovero? Oh, Mike,
okay.
Mike.
Okay.
Which part of Midwood are you near?
Over by Avenue 1, by the old Caravel.
Oh, nice area.
Yeah,
Avenue.
Billy, who used to run the Caravel, now runs the Mirage on Kings Highway.
What about the 3-star in Avenue U?
The 3-star? Oh, my relatives go there all the time.
I love the 3-star.
Yeah, beautiful restaurant.
Say hello to Jimmy.
Okay.
Take care.
Okay, bye-bye.
All right, Anne on line 3.
Ooh, Atlanta's
Thinks she
on
knows
line.
it.
I'm exhausted here. Hi, Ann.
Hi.
How are you doing?
All right.
What's your name?
Is there any truth to the rumor you know who the answer to the quiz is?
Yes.
You think so?
I don't know.
Who's the longest reigning bishop in Brooklyn history?
Bishop McGovern.
Is it that?
Is it?
Is it? Let's ask our judges.
Huh?
I'm going to ask the judges to give us a ruling.
Okay.
Oh, gee. I'm
No.
sorry.
No good?
Now, where are you calling us from?
Brooklyn. Who am I talking to?
Dr. Garner.
Oh.
Okay. You coming to the show on Sunday?
Where is that?
8th Avenue and 2nd Street.
Oh, 2nd Street.
Park Slope.
Who is going to be on the panel?
Oh, we have a great panel, surprise panel. But I'll be there, Kirsty will be there, and a panel of 3. Dr. Backash will be there.
Backash.
We have a neurosurgeon for dentistry, Dr. Goldberg.
Oh.
Goldberger. And we have one other doctor from the emergency room. What do you think?
Sounds good.
Okay, so we'll see you. Come up and say hello.
What time is it?
We'll see you 12 noon sharp.
Okay, thank you.
Take care. Now we're getting drumming up some business. Who's next, Kirsty?
Next on line 1 is Mike from Bensonhurst.
Is Mike back for a stab at the quiz?
I think so.
Hey, Mike, how you doing?
How are you?
Good to talk.
Yeah.
We're having a hard time getting this quiz today. What do you think?
Oh, I think I got the answer for you. It's about time. I've been watching you so many times.
So, you think you may be carrying home a plaque tonight?
Well, my wife wants to have one hung up in the spare room for us, you know, and we've been watching you. I talked to you last week.
Yeah, I remember.
Yes, and...
How are things out there in Bensonhurst tonight? Is it raining?
It's storming, rain, and the streets are flowing down the... Oh, it's terrible.
You think that Vegas Diner is the best diner in Brooklyn?
No,
That's
Vegas
what they
Diner?
said.
No, Del Rio
Vegas.
is best.
No.
I was going to tell you about Del Rio's. They got this King Kong burger. You got to try it.
Oh,
if you
is
can
that
do
where,
it.
in Kings Highway?
Yeah, Kings Highway.
We're going to try
Del
that
Rio.
out. So, Mike,
Oh,
they're
you
pushing me
have to.
along here. I got these taskmasters
Okay, go
tonight.
ahead. You want the answer?
I want the answer.
Bishop Lachlan.
Lachlan. Is that your final answer?
Yes.
All right, let's see.
Bishop
Judges,
Lachlan
is it Bishop
is the
Lachlan?
longest-serving bishop of Diocese of Brooklyn.
Is it Bishop Lachlan? Wow, Mike.
Yes.
Ooh, that's like pulling teeth. That's fantastic.
I got it. Thank you, Kirsten. What's Christian?
She gave you a lot of moral support, Kirsten?
Yeah.
He was thanking you for your
Oh,
support.
you're welcome.
Yeah.
Of course,
No,
I'm here
thank
for you.
And he was born December 20 on my wife's birthday. That's the problem. I says, I got to check it out. 1817.
1817.
Yeah, December 20th. My wife's birthday is December 20th.
Wow. How many years?
What?
How many years was he serving?
He was. Oh, I didn't. It didn't show the years of serving. He's just said the longest.
Excellent. We're really great. I'm glad you got it. We'll get that plaque out to you right away.
Oh, I'll give you my address.
You give the address off the air, and then we're going to see you on Sunday, or no?
I would love to come. I'm going to try. If not, I'll pass by. But I know where it is because I used to live in that area.
Okay, we look forward to seeing you come up and talk to us.
Thank you very much, Dr.
Take
Gardner.
care. Thanks a lot, Mike.
Okay. Yes.
All right, so
got
we did the quiz.
Yeah, it was a lot of people interested in the quiz. Most they forget their health problems and they get the quiz, right?
Well, we do have a health question now from
okay.
Kathleen on line 4.
Good. Maybe we'll have some time to talk to the doctors about some health issues next.
Yeah.
Hi, Kathleen.
Hi there.
Where are you calling us from, Kathleen?
I'm calling from Kensington in Brooklyn.
Oh, not far from the studio.
No, not far at all.
Have you eaten anywhere? What about that place? You know, it's a place called Sote and Anteca. It used to be on 4th and 7th Avenue. Now they moved to 8th Avenue in the Prospect Place. What I don't know what that street is called.
Oh, Prospect Avenue.
Yeah, I think it's a good place. I ate in there.
Yes, it's a small place, but it is good.
Right, it's on the corner.
Yes.
Yeah, I recommend that place if anybody's looking for a new place. Very reasonable.
Yes, I agree.
So what can we do for you?
I'm just calling off the cuff. I'm suffering from plantar fasciitis.
Wait, I want you to take a step back from the TV and just talk a little louder.
Okay.
Okay, where are you suffering from?
I'm suffering from plantar fasciitis in both.
Oh, plantar bursitis, fasciitis maybe. Wait,
Plantar fasciitis.
under your foot?
Yes.
Okay. So let's ask the emergency room. Somebody walks in limping, has pain under the foot.
Typically, we would start with an X-ray if you had any trauma to your foot, and go from there. Have you seen anybody who told you had the plantar fasciitis?
Yes, I did see a foot doctor.
Okay. The podiatrists are really good at managing these foot problems. Did they say they wanted to do an injection, or did they give you some medicine to take?
I actually had 3 cortisone shots.
Okay.
And
Did it
this
help?
is going on for about a year. Not really.
Well, you know, you also have to rest it. Sometimes
Yes.
there's a special shoe they have you wear, particularly at night.
Right, the night boot.
Yeah. The bottom of your foot is irritated, and you basically have to rest it until it gets better. But it will go away. This is not something that most people have to deal with for too terribly long.
Well, is it normal, would you say, like a year, or should it be gone by now? Because I do wear the night boot. I've been to a chiropractor. I do the exercises. I ice it.
So I think that, you know, it's not a year. It probably won't last a year. You'll probably be better in a couple of months, we hope. And
Oh, yeah. I would say maybe even a couple of weeks. You stay
I've
off it, you
had it
rest
for a
it,
year.
you should be better in a couple of weeks.
No, I've had it for a year.
You've had it for a year.
Did you get any injections into the foot?
When I first was diagnosed, I had 3 injections.
Go for a second opinion. Go to another podiatrist. Get a
Just a
second
regular-
opinion.
Just to make
Maybe
sure
a-
it's not something else.
Okay?
All right, great. Thank you.
Feel better. Who's
All
next
right,
on
Dr. Garner, on line 3, we have V from Brooklyn.
V, just V, the name,
Just
I like,
V,
that's a cool name.
I
Hi,
think.
V. V.
Hello, doctor.
Hi, V, how are you?
Very well.
This is S. No?
Yes.
V?
I'd like to ask a question.
Yes.
I seems to be gaining weight, and I want to go on a 1,200 calorie diet. You think
1,200
that's
calories.
advised?
How old are you?
I'm 55.
Okay. So we have V, who's 55 years old. She wants to lose weight. She keeps gaining weight. Any thoughts?
Well, I think it's not just what you eat, also to burn calories is important. So to exercise, whatever you are able to do exercising. But these are long-term conditions, and if you want to have such a strict diet, I tell you, that will work for a couple of weeks. After that, you want to eat again, and that won't last long. So I'm not crazy about those very, very strict diets, unless you have a very short objective, like a wedding, a party, I want to lose weight fast. But in the long run, these strict diets don't work. Not alone, and again, it's association with eating well and healthy lifestyle, including exercise.
So I think it's a great. I'm sorry, V?
I do exercise, but and I hardly eat. I'm never hungry.
You know, that exercise can sometimes be counterproductive. Actually, can increase people's appetite. So to lose weight, really you have to cut down on what you take in. So cutting it down to calories, as long as you have enough, you know, of the nutrition that you need, probably a good idea. Hillary, I'm going to give you the last word on the diet.
I would just say, you know, one of the things that I did recently when I wanted to lose weight is I started keeping track of everything that I ate, and I did that for a month. And I tried to keep track of what exercise I did and what I ate. And you'd be surprised. I was thinking the same thing. I'm not eating anything. Why am I gaining weight? I'm active, and I was getting it in little snacks, nuts.
But I don't even snack. I don't even snack. I eat every morning yogurt with nuts.
V?
And a little bit of, yes.
I'm sorry, I got to go. I'm getting the word that we got the studio till 9, so it's raining. I don't want to get thrown out, okay?
Okay.
Go to your doctor.
Thanks a lot. I can't believe this episode flew by. It really flew by. It was such a pleasure having you. And that's it. I want to thank, of course, Kirsten, who does a great job, as always, with the phones. Thank you, Kirsten Elizabeth.
Thank you.
Dr. Hillary Fairbrother means what again? Fairbrother?
Fair brother, as far as I know.
Okay. And Dr. Earl Schwartzman from Argentina?
Yes, correct.
Where there's great food. And we hope we've been able to help you. It's good to remember to be proactive about your health. Speak to your doctors about your concerns. Go for second or third opinions. Visit our website at netny.net/askthedoctor. Here you can see the weekly tablet columns and watch past episodes and find out more about, now this is all important live taping for the Sunday, September 23rd show. So it's going to be at the Church of the Virgin Mary, 216 8th Avenue, Park Slope, Brooklyn. And you can look up, I think we have in the tablet a little bit about it this week if you need to look at it, but I hope we're going to see a lot of people there, and we're going to be taping a live show which is going to be shown over the next couple of weeks after that. So it's a chance to get on TV, hear your questions answered, and it'd be great to see some of you out there. Some, I say Ivan, but if Ivan shows up, we'll be happy. Thank you for all your questions tonight. For next week, we have questions from the streets of Brooklyn and Queens. Also, tune in tonight at 9 o'clock, and you can see last week's show. Kirsten, that was a good one last week, right?
I loved it.
That was your premiere show.
Exactly.
You're going to be watching this?
Of course.
So as soon as the show goes off, keep it on that station, and you're going to see last week's inaugural Ask the Doctor. I want to say goodbye, stay healthy. I'll see you at the audience show. Remember, this Sunday, and I'll see you in the tablet. Take care.